Oh, we don't have video right now. As long as you have voice, though. Okay, once again, this is the third in the series of 6. A week from today, it'll be on neonatal care, basically taking care of babies. And then Jeff Semler, my colleague in this county, is going to do one on lactation, and then we'll finish up with weaning. So, our topic tonight is parturition, which is really just a fancy way of saying they're giving birth. But I can't say lambing or kidding. I have to say parturition covers all of it. So that's why I like the term. So we're talking about lambing and kidding, the actual act. You can see at the bottom, this presentation you can download from SlideShare. Well, you don't have to download it. You can watch it, but you can also download it. If you ever want to use it for anything, you're certainly welcome to do that. If you wanted to repeat something to your 4-H club or something like that, you're welcome to use any of this stuff. You're welcome to adapt it, do whatever you want with it. Use the pictures. So to start with in this topic, what I say, you got to know when the babies are due. That helps you out a lot. If something starts to go wrong, it helps to know when they're due. Certain management and feeding practices, you need to know when they're due. A lot of you may have an actual breeding date because you used a marking harness or you painted the ram's brisket. I know a lot of dairy goat folks do some hand mating. Then you might just see them do the deed or notice a female in heat, and you might write that down. You certainly need to write down when you put the male in and when you took him out. Notice I said took him out. He shouldn't live with them year-round. That can be a problem. And then you need to do another thing that hopefully doesn't happen to you, but sometimes happens to me when I get the accidents. I mentioned earlier to the folks that I had a ram lamb jump the gate. So while my lamb should be due March 16th, it's possible they could come early. Can't tell you why we're breaking up. I can't do anything at this standpoint. Now, if you don't know if you don't remove the males or don't write anything down, you're kind of not going to know. And so it doesn't mean you can't have a successful lambing and kidding, but you're lacking information that it might sure be useful to have. When you see something that you're not sure, you really don't know when she's due, well, that might help if you knew when. And of course, everybody knows they're pregnant for about 5 months. I know myself, I say 5 months minus a week, because that's 142 days. And I raise a very prolific breed that tends to have a shorter gestation period. So what makes a shorter gestation period? In general, sheep are shorter than goats. The meat and prolific breeds are shorter than the late maturing breeds. Not such a big deal in goats, but that might be an example of saying, well, the Katahdin has a shorter gestation than a Rambouillet, or a Suffolk than a Merino. Female offspring actually don't gestate for as long. Multiple births. There's one of my ewes that had a set of quads. I don't know exactly how long her gestation was, but it was shorter. And then the lighter ones, and some of that goes along with multiple births. How long should the ram have access to the ewes? People have different opinions on that. I recommend 2, no more than 3 heat cycles. In sheep, that's 17 days times 2 or 3. In goats, that's 21 days times 2 or 3. A lot of it depends on how short you want the breeding season to be. You know, there are people, again, that do keep them in all the time. I don't like that because you can't make a lot of important decisions if you don't know when the babies are coming, and you're always overfeeding the ram or buck. And in reality, he's the one in charge if you don't take him out. When she's getting ready to lamb or kid, obviously there's going to be changes. As she gets very close, and even some that happen further out. The behavioral changes, how she acts, is mostly going to be fairly soon till when she lambs her kids. I'm going to say within a day or two. And it's as simple as she separates herself from the rest of the herd. You know, she wants to be on her own. She acts more territorial. She's real restless and nervous. I find this particularly true with a first-time mom. Some of them are just downright crazy, and I think it's because they don't really know what's happening to them. The tail twitching, of course, would be goats, and I think the urination is more goats. Pawing the ground is that natural instinct to make a nest. Getting up and down, you know, that's kind of the comfort thing. I mean, she's ready to go, and she just doesn't feel that comfortable. reduced appetite, when they skip a meal. Although I'll tell you, some animals are such pigs that they could be ready to go in labor, but they ain't going to miss a meal, or they're going to wait till they get their meal, and then they're going to go ahead and have their babies. The physical changes, again, are going to happen fairly close to when they're going to kid or lamb. Certainly the udder is one of our biggest indicators, both when they're going to lamb or kid in general and even getting more specific, because when they do kid and lamb, that udder really fills up, it's firm, the teats are engorged. Does that mean that sheep or goat's going to automatically have her babies then? You can't tell with complete certainty. A lot of these things, the vaginal discharge, the relaxation of the muscles, the belly dropping, the sides caving in, the swollen vulva, you say, well, doggone it, this one's going to lamb or kid, and another one does. So these are general things that happen and general things to look at, but you can't necessarily predict it, within 6 hours or whatever. Now, parturition consists of 3 phases, and we're going to talk about each of these phases. Obviously, the one in the middle we're going to talk the most about. The first is the preparation. Basically, what are the changes that are the physiological changes and the things that are happening to get ready for those babies to be born, and then the actual expulsion of the babies, and then the cleaning phase, the aftermath. Okay, the preparation, basically about 12 to 24 hours before lambing and kidding. Contractions start. The big thing is the cervix is going to start to dilate. The fetus is going to position itself for delivery. You're going to see a mucus discharge. I took the picture of the ewe at the top. She actually lambed in less than 6 hours. She was kind of showing some of those behavioral changes that I showed on the other slide. I'm trying to speak up. Let me know if that's okay. Expulsion. I think they ought to have a better word for this one. I mean, this is kind of the best part of things, when the babies are actually being born. And of course, this starts with the appearance of the water bag or water sac. That breaks, and then the fetus comes out. And of course, we repeat that for the second one, the third one, the fourth one, how many they have. The female may lie down to do this, or she may be standing up. We'll see both. And to be honest, I think a lot of them, as long as there's no problems, a lot of them just want to be left alone. A lot of those real nervous females, if you're hanging around, I think you do affect the progress of lambing and kidding. So some of them just want to be left alone. You can keep an eye on them without being in their face. Okay, so what's the normal presentation for lambing and kidding? Basically, it's what we call the dive position. The little lamb looks like he's diving. The head's resting on the 2 forelegs. The sole of the hooves rests downwards. Keep in mind that the widest part of the baby is usually the hips. Now, in the old days when we had, and not necessarily all old days, we used to have some breeds that were really heavy fronted, and they could have trouble. It could be trouble getting their babies out, or there are breeds that are real thickly muscled, almost double muscled, and there can be some problems with them as well. A backwards birth, the one shown in the picture in the lower right corner, doesn't seem like that would be normal, but it is. The back legs is also normal. It's a little bit riskier, but I'm sure a lot of babies are born backwards that we don't even know about. And I don't mean breech. We'll talk about breech. Backwards is just instead of the back legs, instead of the front legs, you got the back legs. Obviously, you got no head, you got a tail. But that's a riskier position, but it is also generally considered normal. I know myself, if I happen to see a lamb that way, I'll go ahead and probably pull it out because I know it's riskier. If I wasn't there, it's possible that she wouldn't have had any trouble at all with it. The bigger question on a lot of this, especially for new folks, is what's the time frame on these? Once I see her straining, I see the water sac, it breaks, when should she have her babies? Well, she should have the first baby within a half hour to an hour. The time frame even less when you start to see those front legs. Like you can see in this picture, you can see the front legs on this one. This should happen in an even shorter time period. And then the rest of them, and I always hope there's the rest of them, because in the sheep and goat business, I think one of the great things is that they don't have that many singles. They should have more. So we're always, when we're talking about parturition, we're often talking about multiples. And typically they're going to be born within 30 minutes of each other. Now, if a female goes past these general guidelines, it doesn't mean there's a problem, but it means there could be. It's a possibility. Okay? But don't think because the baby's not out in 60 minutes that you definitely have a problem. What it means is you need to check things out. If she hasn't made any progress by 45 minutes to 60 minutes of hard labor and the water sac is broke, you want to check things out. In addition, if she's been in distress for 2 or 3 hours, but you don't necessarily see a water bag, in fact, you don't see much of anything at the vulva, maybe a string or something, that's also an indication that you better check things out. Again, it doesn't always mean there's a problem, although the latter example is more likely to be a problem, but you do need to check it out. This particular ewe in the picture, her first baby in 2010 was a breech baby. I pulled out the first one, and usually once you start, you want to make sure there aren't any left, but she had triplets. Only one of the lambs in the picture is hers, but she started out as breech. And after a couple hours, she hadn't shown any progress, so I went in and checked out and figured out the baby was breech. So how do you assist with the delivery? And if you've never done that, I know it can be pretty overwhelming. Well, obviously, the first thing is you got to catch her and confine her. You got to lay her down. You can do a basic check while she's standing up, certainly. But if you actually have to get in there and do things, you'll end up laying her down. There are some situations where putting her on her back or even hoisting her up is called for. I think that's in the more difficult births. You certainly want to be clean and wash everything. Wash your hands, wash your arms, wash her backside. Use a mild warm soap or warm soapy water. If you're going to go inside of her, you want to make sure you have gloves or the OB sleeves, like the big sleeves they use to palpate cows. You don't want to have long fingernails. You don't want rings on your finger. The purpose of the gloves is to protect her and to protect you. The next point I couldn't overemphasize, and that's to apply a lot of lubricant on your gloves, on your hands, inside of her. You don't want to deliver babies dry. You can use a lubricant jelly. You can use an obstetrical lubricant. You can use bland soap and water. You can use shortening. I've used margarine. I think butter is too expensive. But you need to get a good lubrication, particularly with the more difficult births. What you do is you want to examine the female for dilation of the cervix. Okay, the cervix is the first. I might put the video on a little bit. Oh, I am still on video. I don't know if you can see my fingers, usually if I back up, but this is how you would put your fingers in order to go into the cervix. You want to kind of put them in a cone shape. And you want to check to see if the cervix is dilated, how much it's dilated. If it's dilated a lot, obviously you should be able to investigate. In some cases, you're going to examine the cervix and decide, you know what, she's not dilated enough. I'm going to have to give her more time. If she's dilated enough, you can figure out maybe what's going on. It's possible you don't need to go very far at all, but you want to figure out what position the baby or babies are in. Usually it's baby. Occasionally babies can come out at the same time, but for the most part, you want to determine what position the babies are in. I have a couple of little babies here that I might try to use a little bit, and I'll put the video on a little bit bigger. Okay. Once you've figured out the position, then you want to correct it. Okay? If the baby has a leg back or the baby's breech, you're going to have to do some things. And then you're going to apply traction. You're going to get the baby out. And then possibly you may need to provide a little bit of aftercare for that baby. Now, I put it all in a list. It sounds simple. Do this, 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 and this. Well, I realize it isn't always simple. Particularly, it's not that hard to see how much of the cervix is open, but it can be challenging, especially if you're new at it, to figure out what you're feeling. You're basically putting your hand into a deep, dark hole that's trying to eat you. You know, there's a lot of pressure in there, and you gotta know what you're feeling. One of the things that'll help is to look at pick a lamb or kid up and get to know the different parts of them, which way the hooves go, different types of birth, and what you're feeling. That can help a lot. A couple of tips for assisting with deliveries of utmost importance is be clean, be gentle, be calm, and be patient. If you're all okay, Pam and Don, we're gonna cover each of these birth types as we go through this. Just right now, I want to just give you some general recommendations for assisting with these deliveries, and then we're going to go into some specific ones. Okay, I know when I first got started years ago, I would get all hyper. Well, that doesn't help you, and that doesn't help you, and that doesn't help you get your job done. Be clean, be calm, be gentle, all of that stuff. If you're working on a female for a half hour and you've made no progress, stop. Get some help, whether that's a veterinarian or an experienced shepherd. And when I say shepherd, I mean both a goat and sheep raiser. That's my collective term. But get some help. And don't blame the vet and say, well, they won't come out. You know how easy it is to put a sheep or goat in the back of your SUV and take them to the vet? Heck, don't even call them. Tell them you got an emergency. If you brought a dog in, that had been hit by a car, they'd certainly see it. So if you've got a female delivering her babies, they should be willing to see it. You may not always be able to get them out. When you're done, one of the most important things is to make sure you got all the babies. Usually what I'll do, if one was blocking the way but everything else seems normal, I might leave her alone. If she's already been through enough, I'll go ahead and get them. But always check. And then anytime you go into a U very far, give her some long-acting antibiotic to prevent any uterine infection. Usually LA200 is usually the best. Antibiotics, if it's not a real difficult delivery or difficult problem, are usually just an injectable. Sometimes in more serious problems, a lot more antibiotic is given. It's poured inside. But on a fairly simple delivery where nothing else has gone wrong, it's usually just an injection of oxytetracycline or even penicillin that's a long-acting one. This is Lucy, by the way. Okay, sometimes the baby's going to need help. Sometimes the baby's going to be just fine, but sometimes that difficult birth will have compromised that baby. And the key thing is to clear his airways, clean mucus from his nose. In a regular birth, I don't bother doing that. If I go back a little, sometimes you can see a little bit better. You can put a piece of hay or straw in their nose, and it can stimulate them to start breathing. I do that frequently. If you raise the leg, you can expand the chest cavity. You can hang the baby upside down and swing it. And this is often recommended for like a baby that you pulled out breech. And again, we're going to go into exactly what a breech birth is. Basically, it's coming, but it's still coming out backwards. And remember, that's a little bit more difficult of a problem. And you can give it mouth to mouth. Not too many people want to do that, and I don't even know how often it's necessary, but it is possible, obviously, to blow air into their lungs. After that, put the baby in front of the mom's nose. Unless she's too tired and exhausted from that difficult birth, let her take care of them. That's going to help with the bonding process. If she's really wore out or just not responding, excuse me, you may want to get some towels and clean the baby off. But if she's okay, then put the baby in front of her. In a normal birth, no problems. You can take mom and the babies and put them in a small pen. Can you show how to swing it again? It's basically just in a circular motion, going up like this, but basically hanging them from. I'm sorry, it's hard to get this video thing. but swinging them, getting everything going down that way, and then swinging them. Okay, so in an ordinary situation, everything went fine. I usually put them in a jug. If I'm lambing or kidding on pasture, I'm probably not going to do that unless I have one that had a problem. Like I did have to deliver one, or I had a yearling that wasn't owning up to her babies. Then I'd probably put them in a pen. But on pasture, I'd probably leave them out. Again, if I've got them inside, I'm going to, she doesn't have a navel. George has a navel. This is George. This is George's navel. If it's long, I'll shorten it to about 1 inch, and I'll disinfect it. I usually use betadine. You can use gentle iodine. Lots of different ways to apply it. You can spray it, but most of us like to actually put it in a little. I should have brought some containers. We're going to talk more about this, I guess, probably in the next session. But I definitely recommend disinfecting the navels, particularly if you're lambing inside. Removing the wax plug from the teat to make sure, and check the milk. Those are good practices. And then I just leave her alone, but do observe to make sure the babies are up and nursing. A lot of what you do after the babies are born has a lot to do with your own philosophies. My idea is that no one's out there in the wild pulling the wax plug out, and that the baby should be strong enough to do that, and that their instinct is to get up and start nursing. So I don't go crazy over it. I'd mostly let them take care of things, but it has a lot to do with people's philosophies, and it's okay. These are good things to do to make sure everything's okay. As far as the navel, when you should dip it, I know myself. I guess I don't know the actual answer to that question, in the sense that I don't know the magical time to do it. You certainly want to disinfect it while it's still wet. I often don't bother them for a few hours. I kind of follow what you're saying, is I usually wait a few hours. But you do want to get it while it's still wet. Okay, the third part of lambing and kidding is cleaning. And that's basically expelling the afterbirth or the placenta. Okay? Usually happens within an hour after lambing and kidding. Okay? It's also when the uterus begins the process of returning to normal, what we call involution. I don't know if I said that right. But when people ask how soon will a female breed back, a lot of it has to do with how quickly her uterus will return to normal. Of course, there's a lot of other factors that come into play as well, but getting the uterus back to normal is a big part of it. And mostly this is something that we take for granted. It's just kind of the next part of lambing and kidding, and it usually just happens fine. So the placenta or afterbirth is a nice picture to look at after dinner of the placenta. It's red. It kind of looks like liver. It's got all these bumps on it. I think it's kind of cool looking. And the dogs really love it, but I don't want them to eat it. There's a placenta usually for each offspring. And again, it's usually expelled within that first hour after delivery. Okay? Question is, what do you do with the afterbirth? Do you let them eat it? It's their natural instinct. If these animals were still in the wild, they would eat the afterbirth for a couple of reasons, but primarily because they would want to remove any scent or indication that they just produced offspring, because obviously young lambs and kids are just like prime coyote bait. So it's a natural instinct to protect their offspring. Okay? The placenta also contains oxytocin, which is going to help with milk letdown and also, again, getting that uterus back to the way it should be. So it's natural. Okay? Believe it or not, some people eat placenta. All you got to do is Google placenta and you'll find out some nasty things. But people believe in what's in it. Okay? On the other hand, I certainly wouldn't recommend you let them eat it. I would properly dispose of the placenta for reasons of biosecurity. Placenta or scrapie, that's how scrapie is transmitted in infected placenta. That's how a lot of abortion diseases are transmitted, in those fetal fluids in the placenta. From a sanitation standpoint, you don't want to attract wild animals and scavengers. You want to be clean. You don't want to let your dog eat it. God knows they want to. I actually had one of my guardian dogs try to pull it out of the ewe before she was finished. But I don't let them have it. The other thing is, even though it's natural in terms of having hormones in it, it's not very digestible at all. So you really shouldn't let them eat it. This graphic here just shows what people tend to do with it. The largest percentage of people compost it. That's what I do. You don't want to do the latter two. You don't want to let the carnivores take care of it. Burying it, burning it, composting it. I don't think the landfill or dumps would like to have it either. It's easy to get rid of in the compost pile. Okay, but what can go wrong? I'm going to be the first one to tell you that I think if you do all the right things, things go really well. You feed them properly, you give them exercise, you do your vaccinations, you don't stress them, you have them in the proper body condition, things go pretty well. But even if you do everything right, there are some times that problems can happen. And also, if you do a lot of things wrong, there's times that a lot of problems can happen. So we're going to go through some of these problems. The first couple we actually already talked about in the first session. Pregnancy toxemia. Has a lot of different names. I like the British name. They call it sleeping sickness. As we mentioned in the previous webinar, pregnancy toxemia is essentially low blood glucose caused by insufficient intake of energy, or it's the breakdown of fat into toxic ketone bodies. That thin ewe not getting enough nutrition, it's that low blood glucose, but when we have a really fat ewe and she starts breaking down the fat off of her back, she's not getting enough to eat, so she breaks it down, they become toxic. So who's most susceptible? The females carrying multiple births, the fat females, the thin females, the old females, the timid ones, the ones that don't get their share. Environmental factors, not enough feeder space, stressful weather conditions. Those things can add to the problems. Okay, symptoms. They lag behind. They're depressed. They may show some neurological symptoms, an unsteady gait. They may salivate. They may splay their rear legs out kind of like a frog. They don't want to eat. Eventually they're going to go down, not get up, and die if you don't do anything or you don't recognize it in time. So if you recognize it quickly, all you need to do is give them propylene glycol as shown here in the picture. It's amazing if you catch them early enough what it'll do. If you don't catch them early enough where they're down, they're recumbent, you're going to have to give the glucose through an IV. Other things that are commonly given to the ketotic ewe is calcium, because a lot of those females are hypocalcemic as well, and we'll talk about that in a minute. Vitamin B complex is just a pretty standard thing to give almost no matter what the problem is. If, again, it's even more extreme, then you could induce lambing or kidding, or you can have a C-section done. When I put RX in parentheses, okay, I'll speak up better. When I put RX in parentheses, I mean this as a prescription drug. When I put VX, I mean this is something the veterinarian does. And there's going to be some situations where some of the things I'm going to talk about you still want to have a veterinarian, but these are the things you must have a veterinarian for. You cannot get the drugs to induce parturition. You need a veterinarian. Okay? You can solve pregnancy toxemia by getting rid of the babies. So if you can't solve it and get the ewe so she's capable of delivering the babies, then you induce it or you pull the babies. If there's a problem, if you suspect pregnancy toxemia, you need to look at your feeding program because it may be more than one female that will be affected. Okay, milk fever. Pregnancy toxemia occurs in late pregnancy. Milk fever can occur in late pregnancy, usually closer to parturition, or early lactation, particularly with dairy goats and definitely with dairy cows. It's low blood calcium. Its symptoms overlap with pregnancy toxemia. It looks the same. I think some of the nervous systems are more common with milk fever. What is the target date for viability if you would have to induce? Well, the first thing I'll say with that question is this is another reason why you got to take that male out and write the breeding dates down. Not necessarily the breeding dates, but the breeding range, so that you might be able to answer that question. I'm not exactly sure if you had a breeding date or an early breeding date. I'm not exactly positive exactly what day they might, where they might do it. Certainly I would say 140 days is going to work, but I don't actually know that exact date. And in many cases it doesn't matter, in the sense that she's near the end of pregnancy, and guess what? She's going to die if you don't do it. So in some ways that's a moot question. Okay, if you catch her early enough, you can give calcium, but more than likely you don't catch this until they need a little bit more calcium, and you may be able to give it subcutaneously, but if they're really down, you're going to have to give it via an IV. And again, this is a herd or flock problem. If you suspect it, you need to look at your whole nutrition program. It can be an isolated case. Back when we talked about feeding orchard grass and grain and free choice minerals, the majority of them could be fine, so it could be isolated in that sense. But it's usually an indication that there's an inadequacy in the feeding program. That's why it's so good to force feed what they need. Abortion, we talked again about this in the first webinar. It's basically the early end to a pregnancy. Even though sometimes the offspring can still be born live, they're just not very viable. There's lots of causes of abortion, toxins, trauma. The picture here is obviously of an unviable offspring. This was one of my lambs. It was from a set of triplets. Didn't have a face. I actually think it's kind of cool looking. Stress. Go ahead, let a bunch of dogs run your sheep and see what happens, or your goats. And of course, the ones we worry about the most are the infectious diseases. Chlamydia or enzootic, Campylobacter or Vibrio, which is highly contagious to humans, toxoplasmosis, which humans can get, and Salmonella, which is probably the only one that actually affects the health of the ewe. I'll keep trying to speak up. I don't know that I can do anything about breaking up, unfortunately. The symptoms of abortion, basically you have stillborn, weak, or premature babies. In some cases they may be sick. In some cases they don't get sick at all. A lot of times if they abort early, they'll reabsorb everything. If they abort much later, they should be able to pass them. And obviously when they don't, those are some major problems that you may have to deal with. How do you control abortion? Again, we talked about this in the first session. You need to isolate the ewes that abort. You need to dispose of the fetuses, the placenta, and the fluids. You can give antibiotics, again, oxytetracycline, LA200 to the remaining females. And if you have a lot of abortions, you want to work with a diagnostic lab or a vet to find out the cause. Prevention, well, one of the good things is once a ewe or doe aborts, she develops immunity, so your risk is usually the younger females. You can feed or inject antibiotics, as we indicated in the first webinar. You can vaccinate for chlamydia and Vibrio. You need to be concerned about your cat population. There's nothing wrong with having cats in the barn, but there is a problem if you keep letting them have kittens. Kittens are the primary source of toxoplasmosis, and feeding an ionophore may help with toxoplasmosis. Again, an ionophore is Bovatec or Rumensin, with Rumensin probably being the most effective in terms of abortion. And if you don't have a lot of abortions or a known cause, you don't need to do some of these. As far as breaking up more than the other lectures, I'm going to have to blame that on, I don't know, because everything here is the same, so I'm not sure. And other folks, if you're breaking up, let me know see if there's a high percentage. Okay, a vaginal prolapse. As you see in this picture, it occurs during the last month of pregnancy. It's much more common, I think, in sheep than goats. That's one of the things that we need to talk about at times, is the same diseases affect sheep and goats, but sometimes one's more likely to affect goats and one's more likely to affect sheep. Otherwise, most of the diseases tend to be the same. The extent of the prolapse varies, and it usually has it's almost kind of like a rectal prolapse in that it may start out with a little bit and then it'll go back in, and eventually it may be big and even much larger than this and stay out. So it runs the whole continuum. Okay, a lot of things have been kind of contribute to prolapses vaginal prolapses. And this is a long list, and basically what it means is we don't really know exactly. I call this vaginal prolapses like a lot of other diseases. In order to get them, you got to have the perfect storm, and that's a bunch of factors converging. But these are the things that can or may have an impact on a U prolapsing. Probably the most important ones are the last three. Okay? Obesity. Let's not get these animals too fat. Okay? If she's prolapsed once, she's probably going to do it again. If she prolapses, get rid of her and her offspring. Those are probably the most important factors for you to consider. Okay, what do you do if a ewe or doe prolapses? Ideally, before you do anything, you provide pain relief. And I realize that only a veterinarian could do that, and so a lot of you aren't going to be able to do that, although ideally you would. You're going to clean that tissue that's outside of her body using a mild soap. And you're going to put it back in. And you're going to need it to stay in. And there's a lot of different ways you can keep it, not a lot, but there's several ways to keep it to stay in. One is to use a U spoon or bearing retainer shown in the bottom picture. It's the yellow thing. The other is to use a prolapse harness, which is shown in the top picture. They're also using it in the bottom picture as well. They're using both. You can make prolapse, what they call a prolapse truss. It's kind of basically the harness, only you're making your own. And some vets will stitch it up. Now, keep in mind they can lamb or kid with the three above, but if it's got a suture in it, you're going to need to remove that suture before she lambs or kids. Most cases, once she lambs or kids, problem solved, at least for that lambing and kidding. You may not want to keep her. You probably shouldn't keep her or her female or her offspring, but you've probably solved the problem in the short run. If you haven't, let me turn the video off. Good idea. Can you hear me okay? Let me know if that works. Thank you, Arnold. That might be what it is because we weren't doing that before. And again, really the video is not going to add much. So great. Thank you. Wonderful idea. Again, you should get rid of her. If it doesn't solve itself simply, often it's kind of a prelude for more problems to come. But in most cases, parturition usually solves the problem. Dystocia, which is just the fancy name for having trouble having babies, complicated births. There's several different things that can cause it. The most common cause of a ewe or doe not being able to deliver babies is it's not in the right position. It's got a leg back. It's got a head back. Its elbows are locked, something. The cervix doesn't dilate. Either it doesn't dilate enough or it doesn't dilate at all. There's a mismatch in size. Big baby, small mom. Okay, which can be caused by a lot of different things. And again, the vaginal prolapse can be a prelude for more problems to come. What contributes to having this problem? Well, I think it's definitely more likely to occur in a young female, particularly if you're breeding so that they lamb and kid on their first birthday. I think you're more likely to have problems some of the older females. It's logical. They have a prime production time, and then at other ages there can be more problems. Obesity. Cannot overemphasize not having these animals too fat. I don't want to see them thin, but they need to be in fit, athletic condition, maybe average plus. But we don't need these condition scores 4 and 5 out of 5. And there's an old saying in Texas, they say if you name them, you're feeding them too much. If you name your sheep or goat. Well, what they're saying there is if you have a pet, you feed them too much. Well, it's okay to name them, but gosh, you need to feed them so they're not over fat. And I know it's a problem when you have just a few, or you have different size females. You really need to make sure they're not over fat. Okay, how do we get babies that are too big? Well, we overfeed. Even if she's not fat, we overfeed during the latter part of pregnancy, and the babies get too big. She's got a small pelvic area. Either that's her nature in general, or maybe because you didn't take the buck out, he bred a very young doe, or he bred a doe that wasn't big enough to breed. We don't have near as much problem as the cattle industry in terms of our genetics on large offspring, but we do have it. We do have it. You don't want to breed big breeds to small breeds, especially if they're young. So keep some of those things in mind. Lack of exercise makes sense. I don't know if it's proven, but it certainly makes sense. And you are more likely to have problems with multiple births, just because more things can happen. On one hand, they're better because they're smaller, but they can get in some different positions. So those are the causes of dystocia, or difficult births. And what are some of the difficult births that you can encounter? I've got pictures to show several of them. These pictures were from Ontario, Canada, a really good fact sheet that they wrote. In fact, there's a lot of really good fact sheets and books that can help you with obstetrics if that's something you'd like more information on. The first thing is just an elbow lock. Everything looks normal. You know, you see the nose and you see the feet, front feet, but the elbows are locked behind the pelvis. Pretty easy to correct. We see one leg out, or the other one's back, or maybe both legs are back. Or you just go out there and you see this big old head sticking out. And obviously that's usually an indication that the legs are back, if all you do is see the head. Okay, so what do you do? Well, hopefully you've done all the things we talked about earlier. You've cleaned her, you're clean, you've got lots of lubricant, you don't have fingernails, you don't have rings, you got her secured, maybe hopefully somebody to help you. You've got her on her side, on her back, something like that. With these situations right here, I call these easy to correct. They are the easy ones relative to the other ones, but that doesn't mean that it's necessarily going to be easy for you when you're first getting started. But basically with all of these, you got to push back. You got to push them slightly back into the womb. You want to cuff the hoof in your hand so that as you extend the leg, you protect her uterus. You don't let that hoof tear into anything. And so you're basically, in all these, or the first three examples, you're extending those legs. Now you've already got the hoofs in the elbow lock. You're just going to kind of extend that elbow out. And then the other ones where you don't have the legs, you're going to have to go back farther, and you're going to have to cup and extend that leg. If the baby's real small, it is possible to deliver that second one leg back. If it's a small baby, and particularly if the leg is like the one in the third, where it's kind of all the way back, it is possible to deliver that baby. I don't necessarily recommend you do that, but it is possible. And there could be some really difficult births that pulling it out that way might facilitate things. Now that one with the swollen head, and the picture you see is one that had a swollen head, and obviously he's been delivered. One of the weird things, it amazes me how long that head can be sticking out, and how nasty it can look, and how swollen it can look, and how she can sit on it and it's still alive. It just absolutely amazes me. If you have to put the head back in, obviously you want to clean it. You don't want to put a dirty head back in. A lot of times it's going to depend on exactly what the problem is, because you're going to need to get around the head and find out where those legs are. But clean it. But again, wash the head. You can tell if it's alive by sticking your finger in its mouth. But like I said, it amazes me sometimes how long they can go. And when I say long, I don't mean days. But I mean, a lot of times one could start lambing or kidding, and you leave for work and don't get home for 8 hours, and you find it this way. And it amazes me how well they can do. But the swollen head is an indication usually that the number 2 or number 3 is a problem. And they're very, like I said, they're very easy to correct. Now, what about the more difficult ones? And these aren't even the most difficult ones. The first one, I use the same picture, but a tight birth. You've got a very large baby for whatever reason. Mom's too small, baby's too big, you fed too much, whatever. In most cases, they just need a little bit of help. In most cases, they're just kind of wore out. Lots of lubricant. Lots of lubricant, firm pressure. Sometimes it helps to pull the skin of the vulva over the head, and then you extend the legs. If it's a big baby, again, you want to do both of them. The second one, the head back. My personal experience, this is the one I've had the problem with. And I only had 1 year where I had, I think, a couple. I haven't had it since, and I didn't have it before. But this was the one I had the trouble with, because basically you got to get that head out. You know, you got to get the head up with those feet. And the picture doesn't look so bad, honestly, but I'll tell you, sometimes that head can be way down in there, way down in there. But essentially, you're going to have to push back and get that head turned. The third one is what we call a breech birth. A breech birth is not backwards, it is butt, tail. It's tail. You're going to have to deliver this baby backwards. And you're going to deliver it very similar to the frontward one in the sense that you're going to cup the fetlocks, you're going to extend those legs forward. But you're going to want to do it quickly. And I don't mean so quick that you traumatize the female, but this is a very precarious position that you have, and it could not get oxygen or something like that. What happens with a breech is a lot of times it's kind of like when I mentioned, if a ewe has been in distress for 2 or 3 hours and all you see is a little string hanging out, that's pretty likely can be a breech, because things aren't going right. It's not causing the normal things to happen, and so she's not able to deliver the baby. So that's a case definitely when it's a couple hours and nothing's happened. And sometimes if you don't get there in time, you might lose that first baby, but hopefully the next two or the next one are okay. Or sometimes that first baby maybe needs a little bit of aftercare, and sometimes he's fine. A lot of it depends on the timeline and, of course, the individual baby. But I think a lot of breech births, a lot of times I think they're just occasionally going to happen. I had one this year. I probably average maybe one every other year or every third year. And I've had pretty good success with them. The last one is simultaneous, when babies are trying to be born at the same time. And that's just one example of how they can get tangled. I'm going to try to speak louder. When you've got multiple births, there can be a lot of configurations in the womb. In this case, yes, they're really trying to be born at the same time, but there can be other problems with multiple births in terms of the way they're situated. One front, one back, that sort of thing. And essentially, what you're doing, the hardest thing here is finding out what belongs to who. This is where it's really helpful to understand the way the legs work and knowing where the dew claws are and following back to shoulders and knowing what you're feeling, because you got to figure out what you're feeling, and you can't pull two lambs out at the same time. One's going to have to be pushed back, but you got to make sure you have the two front feet. So that's the challenge, is figuring out what you have. The question about calling a female that delivers a breech, I do not have any indication that it's genetic. Of the ewes that I have had breech, they've never done it again, and their offspring haven't done it. But I'm not aware of anything that links genetics to it, although I'm always open to that possibility. What I got listed as nasty problems, I missed one. Really, really large fetuses sometimes can't even be pulled out and have to be pulled out in pieces. If she aborts, or you have that situation where you weren't able to, for whatever reason, you didn't get assistance, so the babies die in her and start to decompose, or you get a strangely deformed baby. All of those can be pretty hard to deal with. People that have had sheep for years and years and years and goats for years and years and years probably are able to deal with those problems on their own, but I think for most folks, this is probably where you're going to need to have a veterinarian involved. These are when things have obviously gone wrong. So, if you ask me, this is the worst problem one of the worst problems that you can have at the time of lambing and kidding. We call it ringwomb, and this basically is when the cervix does not dilate. And you can see in the upper diagram where the cervix is. A lot of people also, when they don't dilate completely, is also problematic. The cause is not really widely understood. Certainly if they abort or go into labor prematurely, they might be more likely not to dilate. There was a study done in West Virginia a number of years, well, probably about 10 years ago, that looked at the genetics, and they determined that it was genetic and that it was the genetics of the fetus itself that caused ringwomb. When I was a kid, we had a year where almost all of our ewe lambs had ringwomb. And And yet I've read things that say that young females aren't necessarily more likely, or any breeds aren't necessarily more likely. I don't think we fully understand this condition. If it partially dilates, a lot of times you can manually stimulate the cervix to open wider. You can get oxytocin, which is a veterinary prescription to help possibly dilate. But there's got to be something that started. If it's true ringwomb, meaning the cervix has not dilated, I'm sorry, there's nothing you can do manually or drug-wise. I remember when I was a kid, I worked for a local vet, and we had, this was the year we had we had these ewe lambs with ringwomb. He came out and he tried to manually, he gave her oxytocin, he tried to manually open the cervix. Well, he did finally get them out, but she expired and they were dead. Really the only way, if you have ringwomb, I'm going to be totally honest, if it's true ringwomb and they are not dilating, you need to have a C-section done. The ewe on the right was a Katahdin Dorper ewe that was carrying 4 lambs. She did not dilate. The three of them had died. She aborted the 3. I had a C-section done on her, and we had this one lamb that was perfectly. He was much bigger and he was viable and he did fine. But if I hadn't had that C-section, there would have been 4 dead lambs and 1 dead ewe. So if it doesn't dilate at all, you got to do a C-section. If there's some dilation, there is some possibilities. Okay, a retained placenta. Remember, this should come out in the first hour or 2. If it's still not out, 12 to 18 hours, especially 24 hours, you might have a problem. The treatment, you can give it a gentle tug. This is a cow because I can't find or don't have any pictures of a retained placenta in a sheep. But you do not want to put much pressure. You do not want to forcefully pull it out. You do not want your guardian dog pulling it out. The main thing we can do as producers is when the placenta's not out is we put them on antibiotics. Calcium is another good thing to give them. Question about C-sections. I have kept ewes that had C-sections and they lamb perfectly normal. People have different opinions on that. If you have the ability to cull a lot of animals, I mean, you have a big herd, you have the ability to cull a lot, you certainly would cull her, but if you have a small herd, it just depends. You can also give oxytocin or prostaglandin. Again, a veterinary would need to do that. And I think that's more of a cow treatment because I don't know that this has tended to be a huge problem. Again. When I personally saved ewes that had a C-section, they lamb fine the next year. What would cause retained placentas is a lot of different things up here that I mentioned. A lot of times, anytime you intervene, there can be consequences to that, especially if you're not, again, gentle and clean. But a lot of different things can cause retained placentas. They're often in combination with other things. Would you cull for ring? What do you mean by ring? Okay, a prolapsed uterus is probably the other thing worst thing that can happen when you're lambing and kidding. This is a picture from the UK. They got a nice fact sheet on prolapses. And basically it's the uterus is turned inside out and comes out. Just like you see here in the picture, you can see the cotyledons on the uterus. It may occur right after they give birth or several days later. And as you can imagine, it's life-threatening. They can die from this, and people that have raised sheep long enough have saved sheep from prolapsed uteruses but have also lost sheep probably. What causes it? Question was about if cervix doesn't open, should they cull? The West Virginia study suggested that not so much the individual female, because again, the genetics they saw was in the genotype of the fetus. So in this case, cull the ram. We always want to blame the female and cull her. By God, this is the ram's fault. Cull him. Lots of causes. Other problems. This can just be one more thing added on. A uterine infection, a retained placenta, a long delivery, an assisted delivery, nutritional deficiencies, obesity. Again, the perfect storm. Lots of things. As far as we know, there's not a genetic link in terms of prolapsed uteruses. In other words, if you get her through it, it's okay to keep her. Short tail docking, what impact might that have? All prolapses, I'm going to say, require the perfect storm. There's no one single factor that causes a prolapse, be it a rectal, a vaginal or a uterine. There's multiple factors, particularly on the first two. And so you're adding one more factor. Certainly on the rectal prolapse, but there's also some indication on the vaginal prolapse that short tail docking is an issue. So you are adding one more factor. What do you do with the prolapse uterus? For new people, this is often a situation, again, where you go to the vet. You get the vet out there, or you get an experienced shepherd. For people who've been around a lot, around the block a lot, this is something that you learn to do, and very often you can do it. Very first thing you do is you need to protect that uterus. You know, if you're not going to work on her immediately, or you have to wait for the vet, you know, put a sheet or something under it and protect it. This is an organ. You need to protect it. Again, you should definitely give her an epidural. That requires a veterinarian. What you're doing to her is painful. From a welfare standpoint, you shouldn't just do it. I know many cases we do, but realistically, if you're concerned about her welfare, she should have an epidural. You need to clean the uterus. Obviously, this thing's going back in. It's got to be clean. You need to put her on her hindquarters. Elevate her. I don't mean put them on her. Elevate her hindquarters. Sit her on her head. It's going to make it easier to put in there. You're going to put the uterus back in. And for those of you who have done it, you know it can be a challenge. A veterinarian that I often consult with out of Virginia Tech, he recommends pouring 5 gallons of water into the uterus so that water can kind of stretch out those horns. He basically describes a prolapse uterus as if you were taking your sock off. You know, when you pull your sock off inside out. That's basically what a prolapse uterus is. Some veterinarians will suture. I know this vet opposes sutures because, you know, he doesn't think that that's, you know, it either works or it doesn't. Some veterinarians will give oxytocin, which is, you know, calcium, because again, they're often often mildly hypocalcemic, and certainly antibiotics because you want to protect the uterus from getting infection. Warm water, yeah, I would use warm water, not hot water, not cold water, a mild soap. No milk. You know, what's one of the worst things in the world is to have a beautiful set of babies and no milk. And it could be she's not ever going to give you milk, or it could be she's not let it down yet. And there's different causes. Is it the perfect storm? Again, it's hard to say, but there can be hormonal, nutritional, difficult birth, stress. I think sometimes when ewe lambs, first-timers, that first experience for them is very stressful. It also can be an indication of disease. Mastitis, both OPP and CAE, ovine progressive pneumonia, and caprine arthritic encephalitis, they're kind of cousin diseases. Both of them can cause hardback. About the only treatment you can give is to give her an injection of oxytocin, because oxytocin is the hormone that causes milk letdown. Years ago, I heard that they said they'd give a sow, a hog, they give her a can of beer, and that helped with milk letdown. I don't know if there's any old wives' tales with sheep and goats, but I heard that about cows. Obviously, when you don't get milk, if you don't get the milk letdown, you're going to need to do something with those babies. Obviously, they're going to need colostrum, and we're going to obviously talk more about the neonatal care next time. You may have to cross-foster them or bottle feed them if you never get any milk down. And certainly, I would get rid of her. What happens when they don't want their babies? Lots of reasons why they don't want their babies, and we get confused. We really don't know. A lot of it's the young moms. She's a rookie. She's never done this before. What are those two things lying on the ground next to me? She's real high-strung. She really bonds with that first baby. Doesn't want another one. Second one is slow to come. First one is so strong it runs away. Then all she wants is the second one. If it happens a little bit later, maybe the nursing hurts. Maybe she's got a painful udder or sensitive teeth. Check her udder out. Maybe the baby has sharp teeth and makes it hurt, in which case you can file it down. Maybe you gave her the wrong baby. I know I'm guilty of this. I know I got 2 ewes and 6 babies, and they're all white. Who gets who? Sometimes we get it wrong. Abandonment. I think they know when certain babies should be abandoned. I think they know. They can't count. And then here's my favorite one, racism. That black ewe in the picture, she had a white lamb and a black lamb. She didn't want nothing to do with that white lamb. I've had that happen before. Basically, we're saying a lamb looks different. And I guess her vision is overriding her other senses. That's not my baby. Or it could just be coincidental. But all sorts of things can cause this to happen. And this can be pretty frustrating. Sometimes you solve it simply by putting them in a pen with their babies, particularly a yearling. They're confused. Putting the baby in front of the mom's nose. Trying to fool the mom with some different odors. Because remember, recognition is primarily odor. When it's not working, you may have to hold the mom. And this can work in the short term, and then maybe the next day she comes around. You can put her in a head stanchion like the picture below. That's usually, if I have one, that's what I'm going to do. And I sit there and look them in the eyes and tell them you're staying in there till you let them nurse. It's been pretty successful. I'll usually let them out a little bit of the day so they don't have their head in there the whole time, but it can work really well. Obviously, if you can't get them to accept them, you can foster them off. I have had success with that. You can raise the babies with a bottle or a stanchion, and you can give the babies away. But hopefully this doesn't happen. And again, we're going to talk more about feeding orphans and that sort of thing our next session. Keep in mind that most ewes and does lamb fine, kid fine on their own. They don't need you. They don't want you. They've been doing it for centuries. And don't be eager to help if you don't need to. If she's still not pushing the baby out and she's been an hour but everything's normal, leave her alone. Leave her alone. She might not have read the book. You know, don't be too eager to intervene, and that's probably one of the hardest things to figure out. When do I need to do something and when do I need to let nature take its course? That is the biggest challenge, and you learn that with experience, and they teach that to you. If you have a lot of problems, you probably got something wrong with your program. You're overfeeding, you're using a ram that's wrong, you know, too big a breed, or he has that gene for ringwomb. You're stressing. If it happens a lot, if you have a lot of problems, you need to look at your whole program. It's normal to have some problems. And when you have a perfect year, that's fantastic. And you're going to have years like that, but you're going to have years when you have a few more problems than normal. What gets hard to tell is if you have a real small flock. You know, I have 10 ewes, and 2 of them have problems. Well, if you had 1,000 ewes and 200 of them have problems, you've got major problems. But you have 10 ewes and 2 of them have problems, it's hard to know what's random, and it's hard to know what might be indicating a problem. That is one of my favorite photos, catching that tongue action. And that's the last of tonight's presentation. I appreciate your attention. As before, for those of you who are interested, we'll stay live and answer questions. And for those of you who need to get on with something else, that's fine.